Welcome to ENT Billing Associates presentation on ICD-10. This presentation was created in an effort to prepare ENT practices for ICD-10 implementation and assist with ICD-10 documentation. Responsibility for the usage of this information lies with the user. ENT Billing accepts no liability for misapplication or misunderstanding of topics. During today's presentation, we are going to go over what exactly is ICD-10, what the new code expansion looks like, expectations for documentation, and lastly, what your practice should be doing to get ready for the October 1st implementation date. So to begin, ICD-10 was developed by the World Health Organization as the International Classification of Diseases 10th edition. Currently, we are using the 9th. The upcoming implementation date is October 1st, 2015. The reason we are transitioning from ICD-9 to ICD-10 is to allow for a more specific and accurate representation of medical diagnoses. Most of the world already uses ICD-10. Therefore, adopting the new code expansion, it will allow for improved disease management worldwide and allow for easier data exchange. Additionally, ICD-10 will help improve patient safety and the quality of care. With the adoption of ICD-10, you will notice that the new code set offers an expansion of over 68,000 to 141,000 codes, which is up from 14,000 in ICD-9. Through expanding the code set, it created the ability to select codes with laterality, level of hierarchy, and allows for combination codes. So just a couple of fun stats on the new code expansion. 36% of all ICD-10 codes are used to distinguish laterality, meaning right versus left. 50% of all ICD-10 codes are related to the musculoskeletal system. And 25% of all ICD-10 codes are related to fractures. And the reason there are so many codes for fractures is because 62% of those fracture codes are used to indicate laterality. So what exactly does ICD-10 look like? With the transition from ICD-9 to ICD-10, you will notice that the diagnosis code can now be up to 7 digits long. The first 3 digits of the diagnosis code are used to define the category. So for example, a category may be otitis media. This section will always begin with an alpha prefix. When we go to the next slide, I will show how different alpha prefixes correspond to certain anatomy. So next, the 4 through 6 digit are used to explain the category, anatomic site, and severity. This section is also used to identify laterality. Finally, the 7th digit is known as the extension, and this is used to signify the encounter status. So an example of an encounter status would be an initial counter versus a subsequent encounter. So as previously mentioned, the first letter of the category is an alpha prefix, and therefore each alpha prefix corresponds to a certain anatomy. For instance, you will see that the letter E corresponds to manifestations of the endocrine system, whereas H corresponds to conditions of the eyes or ears, and then M corresponds to the musculoskeletal system. So this table here shows all the major alpha prefixes for otolaryngology. On our next slide, we have some diagnoses that help to display the code structure. If you look at these examples, you can see that H71 corresponds to the category cholesteatoma. Notice that it starts with an H alpha prefix, as this is a condition of the ear. Then when you move to the 4th digit, you notice that this digit is used to signify the location of the cholesteatoma, whether it be the attic, the tympanum, or mastoid. Lastly, you can see that the 5th digit is used to signify laterality. So as you can see, the whole point of ICD-10 is increased specificity. That being said, with increased specificity comes the need for more detailed documentation. In order to code correctly, your documentation must address the following issues: laterality, time parameters, site, expansion of certain conditions, and contributing factors. For those of you who are currently using templates for notes, we suggest that you review your templates to make sure they possess the required level of detail. Also, we just wanted to take this time to reiterate how key documentation really is. If it's not documented, it did not happen, and therefore it's not billable. Additionally, make sure your notes are legible and that they are always signed and dated. Many insurance companies are rejecting notes that are not signed and dated. As we pointed out on the previous slide, laterality must be a key component of your documentation. To show you how key laterality is, we have taken the ICD-10 code 381.20 for chronic mucoid otitis media. With ICD-10, this was the code used regardless of which ear the condition was found. Now, however, with the introduction of ICD-10, you can see there are 4 different codes to choose from. There's an unspecified, a right ear, a left ear, and a bilateral code. In this specific instance, the 5th digit is being used to signify laterality. Here, to show you that, we've highlighted that 5th digit in red. So for all codes that possess a laterality component, a 0 or 9 will be used to signify unspecified, 1 will be used to signify the right side, 2 for the left side, and 3 will be used to represent a condition that is found bilaterally. On this slide, we have 2 documentation examples that deal with a patient presenting with a foreign body in his ear. The first example is what your current documentation may look like. Johnny presents with a foreign body in his ear with discharge. A Lego was removed from his ear. Well, this would be okay for ICD-9, and ICD-10, this would lead us to an unspecified code. So as you can see on this slide, the 9 is being used for the unspecified. So now, what your documentation should really state is that Johnny presents with a foreign body in his right ear with discharge. A Lego was removed from his ear. Because this note addresses the laterality of the foreign body removal, we can use the code with the highest level of specificity. Next, as we mentioned, time parameters are also a crucial part of documentation. When documenting a condition, you will want to note if the condition is acute, chronic, acute on chronic, or recurrent. Again, we are using 2 examples to show the differentiation between poor and good documentation. In these examples, we use a patient who is presenting with otitis media. In the first example, the documentation only notes that the patient was pulling on his right ear. However, as mentioned before, this would lead to an unspecified code because we do not know the temporal parameters. Therefore, better documentation would note that the patient was uncomfortable and pulling on his right ear for a few days. That few days is key because that denotes an acute condition and would allow for coding at the highest level of specificity. An equally important aspect of your documentation is distinguishing the site of the condition. For example, if you are examining the sinuses, you would want to denote if the condition was found in the maxillary, frontal, ethmoidal, or sphenoidal sinuses. Determining a location applies to all anatomical areas consisting of multiple sites, i.e. the ears, tonsils, or adenoids. Similarly, when examining a neoplasm, you'd want to state the type of lesion. So, for example, a type would be skin, bone, or soft tissue. And you'd also want to note the location. So if it's located on the trunk, the ear, the mandible, etc. So again, 2 examples. Here are examples deal with a patient with sinusitis. In the first example, the note only states that the patient presents with a 12-week history of moderate congestion and intermittent purulent sinus discharge, and that there is bilateral sinus tenderness to the touch. Notice there is no mention of site. Therefore, we'd be left selecting an unspecified code in ICD-10. Proper documentation, however, would point out the results of an endoscopic exam. In this case, in the endoscopic exam, it's indicated that the purulent discharge is from the maxillary sinuses. Because of this information, we can use the code that specifically corresponds to the maxillary location. As we also pointed out, contributing factors will also be key in your documentation. For all respiratory diseases and other noted conditions, another condition would be otitis media, you must document the following contributing factors: the patient's smoke exposure, the status of their use or abuse, and if they are a user, their type of tobacco used. Additionally, some conditions may also require the history of alcohol abuse or use. In some instances, multiple encounters for the same patient may be present. An example of this would be if you saw a patient in the ER for a nasal fracture and the patient is now presenting for a nasal reduction in your office. This would be something you would need to denote in your notes so that you could capture the correct encounter status. So now that we've touched upon the general specifics required when documenting your notes under ICD-10, the next section of slides will take you through some of the top conditions relating to otolaryngology and will go over the specific documentation requirements for each of those conditions. So first we will begin with conditions of the ear, and our first manifestation is otitis media. When documenting otitis media, you must cover the type, so for example if it's infectious or allergic, the manifestation, so for example if the patient had cirrhosis otitis media, the infectious agent, if known, an example may be bacterial, fungal, viral, or any related conditions such as scarlet fever. You'd need to denote the temporal parameters, so whether it's acute, chronic, subacute, or recurrent, the laterality, and lastly, any contributing factors. So here we have an example of how a provider would properly document an episode of otitis media. In our example, we have Billy, who is 3 years old and is brought in by his mother for evaluation for multiple episodes of cirrhosis middle ear effusions. He has had 6 episodes of acute otitis media and is experiencing a fever, fussiness, and pulling at the left ear. Billy is also experiencing upper respiratory symptoms. He has had antibiotic therapy, but symptoms have not completely resolved. This is an example of good documentation because the note addresses manifestation, so it says it's cirrhosis, the temporal parameters stating 6 episodes of acute otitis media. It discusses laterality, so it points out the left ear, and it goes over the contributing factors. So Billy stated that he's exposed to secondhand smoke. So by including all of these aspects, we can use a code with the highest level of specificity. Also, we just wanted to point out that anytime you have a contributing factor, there's always going to be that additional code. So there'll be a total of 2 codes. So in this example, you can see because the patient is exposed to environmental smoke, we have used that Z77.22 to indicate his smoke exposure. So just another thing that we wanted to point out. Next, we have the perforation of the tympanic membrane. When documenting this condition, it is important to disclose the site, if there is a single perforation or multiple perforations, if it is a total or subtotal perforation, the laterality, and lastly, any contributing factors. In this case, a contributing factor could be otitis media. So, keeping those specifics in mind, here is a documentation sample for perforation of tympanic membranes. In this example, we have Hannah, who is complaining of hearing a whistling sound in her ear every time she blows her nose. She got home yesterday from a 2-day rock and roll music festival, which she attended without ear protection. She has no ear pain present, but the otoscopic exam revealed that the right ear has central perforation of the tympanic membrane, and her left ear appeared normal. Notice how this note specifically addresses the laterality and the site of the perforation in the tympanic membrane. Therefore, we can use the code H72.01, which would be the central perforation of the tympanic membrane, right ear. Our next condition of the ear is cholesteatoma. When performing an examination, you must address the site of the cholesteatoma and the laterality. To show you how important this is, please look at the chart on the right side of the slide. You will notice how the fourth digit of the code corresponds to location. We've highlighted that in red. So, for instance, you can see that the 0 corresponds to the attic, whereas the 1 corresponds to the tympanum. Additionally, for this condition, the 5th digit of the code is going to be used to signify laterality. So we put X's to indicate placeholders for the laterality here. So in this example of cholesteatoma, we have a 40-year-old patient named April who is complaining of decreased hearing. Her otoscopic exam showed keratin debris in the attic and cerumen in the left ear. The CT scan indicated attic cholesteatoma with the start of bone erosion, and her right ear appeared normal. Because this note clearly stated that the cholesteatoma was found in the attic of her left ear, we can choose a specified code. And as you saw on the previous slide, the fourth digit of the code signifies a site, so in our case, we would use the 0 for the attic. And the 5th digit is used to signify laterality. So in our case, we'd use the 2 to signify the left ear. Now we will move on to hearing loss and other hearing disorders. During your examinations for hearing loss, make sure to document the type of hearing loss. So for example, if it's conductive or sensorineural. And you'll also want to make sure you document laterality. Hearing loss codes can either be unilateral codes, which are specific to the left or right ear, or they can be bilateral. Additionally, the unilateral hearing loss codes have a description qualifier that states there is no hearing loss on the contralateral side. So now we have our hearing loss example. And in this example, we have Doris, who is a 75-year-old woman who is presenting with sudden hearing loss in her right ear. Her audiological tests show unilateral sensorineural hearing loss on the right side. As denoted in the previous slide, this is good documentation because it displays the type of hearing loss and the laterality. The last ear condition we will cover today is the removal of foreign bodies. When documenting your notes, you will want to make sure you cover the site, the laterality, and the encounter status. When we say encounter status, we are referring back to that 7th digit extension we touched upon during the code structure slide. Foreign bodies are one of the code sets that require 7 digits. The 7th digit of this code helps to signify the encounter status. So as we said, this would help to distinguish if it's the patient's initial encounter. So as you see on this slide, that would be signified by the A. Or if the patient previously received treatment and is in the recovery phase, so that would be signified by the D. Or if the patient is having complications, which that would be signified by the S. So those are your 3 7th digit character extension choices. Keeping those specifications in mind, here is a good example of documentation. In this example, you have the patient Bobby, who was brought in by his parents to see the specialist for the first time. And Bobby's complaining that his left ear hurt and that something's in his ear. His examination revealed a small piece of crayon in his left ear. The crayon was removed with forceps. As previously mentioned, this is a 7-digit code. Therefore, the first 3 digits, T16, indicate the category, so in our case, foreign body. The 4th digit indicates laterality, so we have the 2 because it's the left ear. Then we have the 5th and 6th digits, so in this case, they're signified by those 2 X's, and they're just placeholders, and they're there so that we can append our 7th digit extension. And because this is the first time that Bobby had seen the specialist, this would be an initial encounter, and therefore we would use that letter A. So now that we've covered some of the major ear conditions, we're going to move on to manifestations of the throat and digestive system. So we're going to begin with tonsillitis and adenoiditis. When performing your examination, you will want to make sure you indicate the temporal factor, so if it's acute, recurrent, or chronic. You want to indicate the site, the infectious agent, if known, and any contributing factors. So the table on this next slide presents a table consisting of all the code expansion for tonsillitis and adenoiditis. This table also includes which codes require identification of an infectious agent. We've denoted that by the star next to those two codes. So as you can see, the third code and fourth code down under acute have that star to identify other bacterial/viral infectious agent must be specified. Here we have an example of detailed documentation for tonsillitis. This note is a great example because A, it touches on the time parameters, telling us that the patient presents recurrent acute tonsillitis. B, it identifies the infectious agent, which was proven streptococcal by culture. And C, it covers the contributing factors, so stating that the patient smokes a pack of cigarettes per day. It is also important to note that for this condition, you'll have a total of 2 codes. So first you'll have that acute recurrent streptococcal tonsillitis code, and then you'll have the code for the contributing factor. So in this case, the nicotine-dependent cigarettes. Our next condition we will cover is silodenitis. When documenting this condition, make sure to include information relating to the site, the time parameters, and any contributing factors. In this case, you will need to include both smoke exposure and the history of alcohol use or abuse. In this example of silodenitis, we have Brian, who is a 50-year-old man complaining of a sore throat and increased pain when eating and swallowing over the past few days. There is visible swelling on the left side of his face, and after the exam, the patient is diagnosed with acute silodenitis. It is also noted that the patient's wife is a smoker and Brian is an occasional drinker. Similarly to tonsillitis, silodenitis also requires multiple codes. Here we're going to have 3 codes. The first code is K11.21, which is the acute silodenitis. Our second code, Z77.22, will denote the smoke exposure, so in his case, exposure to environmental tobacco smoke. And the third code will be used to signify the patient's alcohol use. So here we have F10.10 to signify that the patient has uncomplicated alcohol abuse, so he's just an occasional drinker. The next set of slides will discuss the top conditions relating to the nose. We will first start with sinusitis. When performing your examinations, make sure to indicate the location. So for example, if it's found in the maxillary or frontal sinuses. You also want to indicate the temporal parameters and any contributing factors. This slide shows the code expansion for sinusitis under ICD-10. You'll note that there are twice as many codes for acute conditions as there are for chronic conditions. There are twice as many codes for acute conditions because acute conditions may be identified as either acute or acute recurrent. Within this next slide, we have a great example of documentation for the manifestation of sinusitis. This note is extremely detailed and touches upon all aspects needed to properly document the sinusitis diagnosis. The note first discusses the temporal parameters, so the note therefore states that the patient has been seen for similar chronic sinus problems over the past 5 years. This statement is important because it is indicative of a chronic condition. Secondly, the note covers the contributing factors, saying that the patient was exposed to secondhand smoke from her father. Lastly, in the examination portion of the note, it specifically states that the CT scan showed inflammatory changes within the maxillary sinus, thus specifying the location of the sinusitis. Because we have all that detail, we can then derive the code J32.0, which is indicative of chronic maxillary sinusitis. Also note we have that second code to identify the smoke exposure, so the Z77.22, which says the exposure to environmental tobacco smoke. The next condition we will address are allergic and vasomotor rhinitis. For these conditions, it is important to document the cause of the condition. Here we have added in a table displaying the crosswalk between the ICD-9 to ICD-10 codes. Unlike many other conditions previously discussed, there is almost a one-for-one code exchange. Additionally, you will note that the 4th and sometimes 5th digit, which we have highlighted in red, are indicative of the cause of rhinitis. So here we have our example of rhinitis. And in this example, it is important to note that the documentation covers the results of the allergy test. Here, the allergy test proves that the patient has a maple tree pollen allergy. Therefore, as the cause of rhinitis is noted, we can choose the most specified code of allergic rhinitis due to pollen. Now we will move on to fractures. As noted in the beginning of the presentation, 25% of all ICD-10 codes are related to fractures, and therefore it is no surprise that a high level of specificity is required when documenting this condition. When performing your examination, you must cover the following. First, you must cover atomic site, so for example, the nose, the classification, the type, the cause of injury, so say the patient fell down the stairs, and you must document the laterality. Additionally, for most fracture conditions, the code will require a 7th-digit extension. This will be used to indicate the encounter status. Here, the letters in red on this slide are representative of the encounter status options, so the A through the S here. The table on this side displays a listing of some of the ICD-10 fracture codes you may encounter. Here we have our first example of proper fracture documentation. In this example, we have the patient Tracy, who is seeing the specialist for the first time. She is an 18-year-old girl who has sustained nasal trauma from being struck in the face by a softball at her game last week. She's complaining of difficulty breathing through her nose and has significant bruising and swelling with left nasal bone step-off. The review of her x-ray reveals a closed nasal fracture. So from this documentation, the anatomic site can be selected. The first 3 digits, S02, are indicative of the category, so in our case, fracture of the skull/facial bones. The 4th digit, the 2, is going to be indicative of the exact location, so in our case, the nasal bones. And then you'll see the 5th and the 6th digits are going to be placeholders so that we can append our 7th-digit extension. Our 7th-digit extension will be the letter A in this case because it's the initial encounter and it is a closed fracture. So as there are a lot of fracture code possibilities, we have added in another fracture example. In this example, Ray is a 72-year-old man who sustained a fall striking the office stairs, and he was brought in to see the specialist for the first time. His x-ray confirmed closed zygomatic fracture. Again, this documentation covers the anatomic site, denoted by the x-rays as the zygomatic bones. It also covers the classification, so we know it's closed, and it tells us the encounter status. So by first time, we can see that it's an initial visit. So again, the first 3 digits will remain the same, so the S02 signifying a fracture of the skull or facial bones. However, in this example, the site is represented by the 4th through 6th digit, so 402. So as such, you'll notice we don't have to add any placeholders here, and we can just append our 7th-digit extension, the A, because again, it's an initial encounter, and the classification is closed. One additional thing we wanted to mention is that for first-time reporting of injuries with related fractures, it is important to report the external cause codes for both workman's comp and motor vehicle insurances. In this instance, we would report the code W10.9XXA to signify that the patient's injuries were related to falling on the stairs. So similar to fracture reporting, we just wanted to point out that injuries and open wounds follow similar documentation requirements, and they also have a code expansion to the 7th digit. So we won't really get into detail on that, but we just wanted to point that out as well. So the next condition we'll discuss are neoplasms. When documenting your notes, it is important to cover the type of neoplasm. Forwarding pathology reports will help to define your neoplasm type. So, for example, a type would be benign, malignant, in situ, or if it has uncertain behavior, so if it's a growth or dysplastic nevus. Additionally, you'll also want to cover any history of cancer, the site of the neoplasm, the laterality if it's applicable, the size, any signs or symptoms, and any contributing factors. When covering contributing factors, it is important to cover the patient's smoke exposure and any alcohol use or abuse. So here we have our first neoplasm example, and this example is related to the digestive system. In this example, we have a patient who is presenting with hoarseness with occasional trouble swallowing for about 6 weeks. She came in when she noticed a lump in her throat. She smokes 2 packs of cigarettes a day and has done so for 50 years. Her laryngoscopy revealed a mass from the supraglottis into the glottis, and her biopsy confirmed malignancy. These are great notes because the notes indicate the site, so that they state the supraglottis into the glottis, so that's the larynx. It also states the type of the neoplasm, so it's malignant. And it also goes over the contributing factors, stating that Gloria smoked 2 packs of cigarettes per day. So on our second neoplasm example, this one's related to the integumentary system. So in this example, the patient is a landscaper with a forehead lesion. He states that the lesion has been present for around 4 months and is enlarging and changing colors. Lesion has a size of 8 millimeters with a rolled edge and a central ulceration. The pathology proves basal cell carcinoma. The patient also states that he is a chewing tobacco user. Again, it is important to note how this documentation indicates a site, so in this example, this forehead/skin. It also goes over the type, so it's a basal cell carcinoma. It goes over the size, which is 8 millimeters, and it goes over the contributing factors because the patient states he's a daily chewing tobacco user. So you can see our 2 codes. So next we will cover polyps. Performing your examinations, make sure you cover both the site of the polyp and any contributing factors. The table included in this slide shows the ICD-10 polyp codes, which are specific to ENT. In our polyp example, this documentation does a great job of covering both the site of the polyp and any contributing factors. We can see that the documentation specifically states that the patient has middle meatus polyps and that the patient smokes 2 packs of cigarettes per day. Therefore, we can derive our 2 codes. The J33.0 is used for the polyps of the nasal cavity, and the F17.210 signifies the nicotine dependence cigarettes. The last condition we will cover today is asthma. When performing your examinations, it is crucial to keep both the type of asthma and the status of the condition in mind. In this next slide, we have created a table that can help with the review of the classification for asthma types. So now that we have gone through in detail the documentation expectations involved in the implementation of ICD-10, we wanted to end by covering what your office should be doing prior to the implementation date of October 1st, 2015. So first off, we want to suggest that all the physicians in your practice attend multiple trainings. And also, it is imperative to educate your staff. We suggest that you use this presentation and say those presentations put out by the AO or the CMS or insurance companies as educational materials. Also, we just wanted to mention that the last slide of our presentation covers all of the resources we used to compile this presentation, so please feel free to encourage your providers and staff to check those out as well. Secondly, we just wanted to point out that you should be on the lookout for updated encounter forms. ENT Billing will be updating the super bills for ICD-10 for all of its clients, but we just wanted to point out that it will not be possible to fit all those codes on the form. So as such, the encounter form will encompass those top codes for otolaryngology. So to fill in any gaps missing on the encounter form, we're going to be putting together a laminated ICD-10 table, and you can keep that in your exam room. So hopefully that would encompass all of the codes you'd be using. Next, you'll want to make sure that you check with your EMR to make sure they're ready for ICD-10. Learn what technology the EMR has, if any, to help you with the transition. Just so you know, ENT billing software is ICD-10 tested and ready. Additionally, on the topic of EMRs, for those of you that use templates, we just want to reiterate that you should start revisiting your templates to include the added level of specificity we discussed throughout the previous slides. So again, just to hammer it home, you want to make sure you're touching upon laterality, temporal parameters, site, encounter status, and contributing factors. And while we're all having to worry about gearing up for ICD-10, it is important to note that workers' comp and auto insurers do not need to adopt ICD-10, so they're going to still be using ICD-9. Lastly, with ICD-10, health insurers will most likely be revisiting policies and reviewing coverage determinations, and they'll also be looking at what conditions they will be covering. So changes to reimbursement amounts are yet unknown, as reimbursements are currently tied to CPT codes and diagnosis codes that support medical necessity. However, there is speculation in the industry that health plans may start looking at how to tie reimbursements not only to the procedure code, but to the severity and specifics of a patient's condition. Therefore, it's important to review your contracts and think about potential disruptions in cash flow. So thank you guys for listening to our presentation on ICD-10. If you have any questions on how to document or code, etc., please feel free to email us at the email on this slide, so icd-10@entbilling.com. We would love to get your questions, and we'll be compiling your questions and then sending out a question and answer sheet to each client, highlighting the top questions asked and their corresponding answers. Additionally, please visit our new website. We got a facelift and we think it looks pretty good. So check that out. And thanks again for your time, and we really, really appreciate it. Thanks again.